you can stop me during the lecture if you want to. It's usually a big mistake to say this in the United States, because people are not shy to ask questions in the United States. But in some other countries, you really have to encourage people to ask questions. But anyway, I'll do it by ear. If your question is not relevant or requires a long answer, I'm afraid I will not. We'll leave it to the end. But if it's relevant and short, you can stop me. And indeed, I do welcome that. I don't want you to sit there and not understand something, and I would rather you ask me than the person next to you. I think this was billed as advanced tongue diagnosis, wasn't it? Yeah. But in a true Chinese way, I always start from the beginning, because there are some very basic things which we must all understand, and there is a danger of missing some very basic things if you jump in at the deep end, doing so-called advanced tongue diagnosis. And one of the first things I'd like to point out, actually, since we are in this type of room, in this type of lighting, is what you need to look at the tongue. And the first thing is proper lighting. And this is a good example of not proper lighting. So if I was doing tongue diagnosis practical work now here, we couldn't do it here. Okay? The lighting here is not good. And most tongues would appear darker than they are. So really the only good lighting is natural light, good natural light. So what you do in the evening, a halogen lamp is preferable to the normal tungsten lamps. And that's what I use. That's what I have on my desk, a very small one, which I actually hold and shine over the patient's tongue in the evening. And in England, it's of course very dark and cloudy very often. And if you're doing tongue diagnosis in the daytime and the light is not good, which I understand can happen here too, I usually ask the patient to go near the window, as close as possible to the window. And I cannot stress this highly enough. You may know everything about tongue diagnosis, be very, very expert at it, and then you do it in such condition, in this room, and you get a completely wrong diagnosis. It will be completely wrong. Most of all, each tongue here would look darker than what it really is. So that's very obvious, but very often forgotten. I've direct experience of this when I went to see a doctor, a Chinese doctor, for treatment myself in London, and he was practicing in a basement, very dark. And he did tongue diagnosis like that. And he came to the conclusion my tongue was dark red, and I know it's not, or at least it wasn't at the time. So you can get completely wrong idea and the wrong treatment, of course, because he came to the conclusion that I had stomach heat, which I definitely don't. Okay? So that's the first thing to point out, is the lighting. Secondly, the patient should not keep the tongue out too long. You probably noticed this yourself. And by long, I mean 30 seconds. Because after that time, the effort of keeping the tongue out will also make it darker. So what I do, especially the first time, I ask the patient to stick the tongue out, then I ask him to put it back in, close the mouth, and do it again, and start again. And you can do this as many times as you like. As many times as you like. There's no problem in doing that. And generally speaking, the first time I see a patient, I do need to do that. Probably 3 or 4 times, even 5 times. In a few cases, talking about this, there is a discrepancy in the tongue. And you see, like, the patient has 2 different types of tongue. You ask the patient to stick the tongue out, and it seems quite long and dark in color and slightly stiff. And then, as the patient is putting the tongue back in the mouth, suddenly the tongue appears wider. I don't know if you've seen that happen. Have you seen that happen? The tongue appears wider and paler. Okay? That's usually the second one is the right appearance of the tongue. And when that happens by itself, when there seems to be two different types of tongues, one when the patient sticks it out with some effort, which is darker and longer and stiffer, and one, I ask the patient to open the mouth and not stick the tongue out too much. And the tongue seems wider and paler. That's the true one. And that discrepancy by itself indicates Qi deficiency. Okay, so you have to be aware of that as well. Yes?
Is Qi deficiency when you have this discrepancy?
When you have this discrepancy. Is a similar thing, in my mind, with the pulse. When there is a big discrepancy with the pulse sitting up and lying down. Have you noticed that? I always take the pulse for new patients, both sitting up first and then lying down. And I always check any sharp difference. In the majority of cases, there isn't any difference. When there is a difference, when the pulse lying down is stronger, that is the true one. And that by itself indicates Qi deficiency. It's very similar to what happens with the tongue. So when the patient first sticks it out with some effort, it looks darker, longer, stiffer. And then you suddenly notice, as the tongue is going in, it is quite swollen and pale. And that's the true one. And it's a very similar thing that happens with the pulse. Okay? Of course, if you see any strange colors on the tongue, there are certain substances which affect it, and this is very obvious. I'm sure you all know that. I don't have to talk about that. Colored substance. If you see a very strange purple color, bright purple color on the tongue, the first thing you should check, of course, is that I haven't been sucking any colored sweets. And I'm going to talk about the influence on certain drugs on the tongue later. I'll leave that to later. The effect of certain drugs on the tongue, such as antibiotics and steroids and things like that. We'll leave that to later. So what is the importance, the significance of tongue diagnosis? Why is tongue diagnosis so great? First of all, because it's a hell of a lot easier than pulse diagnosis. And that's a great thing. You can learn good, solid, reliable tongue diagnosis, I would say, in 6 months with a good teacher and good teaching aids and some practical work. You can learn pretty good, solid, good tongue diagnosis in 6 months, but you can't even learn that in 6 years for the pulse. Okay, so it's a lot easier than the pulse. And the second thing is that it's a lot more objective than the pulse, which is important in Chinese medicine because Chinese medicine is very subjective, as you know. Someone has Qi deficiency, how much Qi deficiency do they have? Chinese medicine doesn't measure events in the same way as Western medicine, which is both a strength and a weakness, I feel, sometimes as well. We don't measure things in the same way as Western medicine. Someone has Qi deficiency, how much Qi deficiency do they have? How much heat do they have? And if you rely on the pulse, it is even more difficult to gauge. But the tongue is relatively objective, at least compared to the pulse. For example, if a tongue is red, you can tell how red it is. I mean, you can distinguish. We can probably do this later today. During the break, I'm going to look at people's tongues and compare. That's what I do usually when I teach this in Europe. I pick up 3 or 4 red tongues and see which one is redder. And you can definitely see gradations of redness and therefore heat. And it's very objective. Anyone can see that. It's not really due to the subjective appraisal of the practitioner. But most of all, tongue diagnosis is great because it nearly always shows the true conditions in complicated cases. And complicated cases, as you know, are the majority of the cases we see. And by complicated, I mean cases that have some deficiency of yin and deficiency of yang. People have deficiency of yang, but also heat somewhere. Complicated conditions of deficiency of both yin and yang, and cold and heat. In such cases, the tongue becomes probably the most important reliable element of your diagnosis. And I'll give you a couple of examples. A very common example is that of deficiency of kidney yin and kidney yang, especially in menopausal women. As you know, in menopausal women, and we'll talk about this tomorrow a lot, a deficiency of both yin and yang of the kidneys is more the rule than the exception. That's why you see many different contradictory symptoms. A woman may feel cold in general, have cold feet and frequent urination, but hot flashes, or vice versa. And this happens all the time. And that's because there is often an overlapping deficiency of kidney yin and kidney yang, which is very common, but it's never 50-50. One is predominant over the other. And the tongue is the most reliable factor to decide which is predominant, which is, of course, very important for the treatment, to decide if you're using herbal medicine, which prescription you're giving, whether you're nourishing yin or tonifying yang. And the tongue is absolutely the most reliable, the easiest way of deciding this. The pulse is no use, not much use in this case. Why? Because one of the most common findings, pulse findings, I see in women, especially of menopausal age, is that both kidney positions are weak, both left and right, equally weak. So that doesn't really help you to distinguish whether it's kidney yang or kidney yin predominantly deficient. But the tongue shows you very clearly. If it's pale, there is a predominance of kidney yang deficiency. If it's red, there is a predominance of kidney yin deficiency. And it's as simple as that. Another example in gynecology, which is also common, is in flooding, heavy periods. As you know, there is about at least five different causes of heavy periods, but two major ones are qi deficiency, qi not holding blood, or blood heat, agitating the blood. And this seems, we'll talk about this tomorrow again in detail. The distinction between these two seems quite straightforward and quite easy, right? The qi deficiency, the woman is pale, tired, so the bleeding is due to the fact that qi doesn't hold blood. With blood heat, the woman is thirsty, has a red face, insomnia, irritability, the tongue is red. So heat is making the blood restless. But in practice, it's not as simple as that. You see many, I'll give you some examples tomorrow, many cases when you can see some symptoms of qi deficiency, but the woman has heat as well. And sometimes it's not easy to make up your mind what the bleeding is coming from. Okay? And the tongue, again, helps you to make that distinction. Because if it's red, and even if it's only slightly red only on the sides, it doesn't have to be all red. When I say red, it doesn't have to be all red. And we'll see later on the concentration of redness in various areas. So even if the tongue is only slightly red on the sides, that means that the bleeding may be due to blood heat rather than Qi deficiency, even if the woman does have symptoms of Qi deficiency. Okay? That happens because you see many women with symptoms of Qi deficiency and they're bleeding heavily, so you assume it's due to that. But it doesn't follow. She may have Qi deficiency and heat somewhere else. So it's very easy. Because so many people have symptoms of Qi deficiency, it's very easy to come to that conclusion. And in my opinion, there is a bias in the treatment of heavy periods towards the Qi deficiency, if you know what I mean. You know what I mean? I even hear people, I often have people consulting me with their patients, and they say, oh, this woman has symptoms of Qi deficiency, and they say, well, where do you see the symptoms? And they say, well, she has very heavy menstrual bleeding. So they even take heavy menstrual bleeding automatically as a symptom of Qi deficiency, which it isn't. Okay? Anyway, the tongue will show you very clearly, even because if it's red or even only slightly red on the sides, it indicates that the bleeding is due to blood heat. Okay? So that's probably one of the most important useful aspects of tongue diagnosis, the fact that it is more objective than the pulse, more reliable, and most of all, it helps you in complicated conditions of hot and cold simultaneously, and deficiency of kidney yin and kidney yang simultaneously. Have you got any questions so far?
I heard you correctly that tongue is red with kidney yin deficiency, pale with kidney yang.
Yes. Yes, I did. I gave you that as an example, but it's not quite like that, because you can have kidney yin deficiency without red tongue. What I meant is that if the tongue is red, that definitely means there is kidney yin deficiency. In this example, okay. We're going to talk about yin deficiency on the tongue a lot, because yeah, we'll talk about that a lot. Yeah.
Can that change? So if a person has a kidney yin and a kidney yang deficiency, can that change from the tongue? So that one time the tongue is pale, after a week or two it's maybe red?
The question is, if the person has an overlapping kidney yin and kidney yang deficiency, can the tongue change? No, I haven't seen that. It doesn't change that. The tongue does change, but not that quickly as you say. 1 week is pale, 1 week is red, no. The tongue definitely does change, and you see that in menopausal women a lot. But you can only deduce that from the history. For example, the tongue, say you see a menopausal woman with hot flashes, night sweating, but unusually she has cold feet and frequent pale urination, so you don't understand why it's happening. The tongue is red. So she has definitely kidney yin deficiency. You can only assume that originally she had kidney yang deficiency, and now it's changing into yin deficiency, or vice versa. It's usually that way around, from yang to yin. But it doesn't change that in a short period of time, no. Only in a long period of time. There was another question?
I just wanted, bearing in mind that this Chinese medicine comes from China itself, they would have more cases of deficiency, whereas if you look at the United States, I would say, if you look at the general pattern, and here's the country where you can get for 90% ample nutrition, from a hamburger or something like that. Don't you have to bear that in mind that generally perhaps the population is more in excess, the symptoms are more in excess?
I don't know, it would be difficult to make comparisons, but I do, like you, my personal philosophy is to give a lot of attention and importance to full conditions, more than most people. I feel, especially in England, I don't know how it is here, that the training is a bit biased, or was, especially in the past, biased towards deficiency. And like you, if a person usually suffers from a deficiency and a fullness, I always start by treating the fullness, usually. Whether there are big differences between China and the West, I don't know, I'm not sure. Who can tell? It would be very difficult to do that comparison. Yeah?
How long it takes time to change color?
We'll talk about that when we talk about body color. I will point it out. Okay, let's start. First of all, you should train yourself to examine the tongue in a systematic way. And I cannot stress that highly enough. Don't be sidetracked by small details on the tongue. And develop a system. And my system is, first of all, body color. First and foremost. So that's the first question I ask myself. What color is this tongue? The body of the tongue, not the coating, the body of the tongue under the coating, okay? Second, the body shape. And third, the coating. These are the three major aspects of it. And fourth, the moisture. And this happens all the time. You know, colleagues ring me up, they present the case histories, and I say, how is the tongue? And they say, oh, I had a yellow coating, you know. And that really gets me on my nerves, because, you know, what was the body color? You know, yellow coating is relatively unimportant, as we will see when we talk about the coating. The coating is subject to very short-term influences, unlike the body color. So the yellow coating may be totally unimportant, maybe, or secondary, okay? The first thing I want to know, what is the body color? Is it pale? Is it normal? Could be normal, pale, red, or purple. And the second thing I want to know is the body shape. And the third, last thing, is the tongue coating. Okay? So I cannot stress it highly enough. First thing you ask yourself is, what color is it, the body, not the coating. Okay, so let's talk about, first of all, the normal tongue. What does the normal tongue look like? What is the normal body color? It's pale red. And the Chinese books usually explain that by saying that the stomach fluids make it pale and the heart blood make it red. And therefore, the combined influence of the stomach fluids and heart blood gives the tongue that pale, red, normal color. And we should never forget, actually, also that the tongue as a whole, from tongue diagnosis, you can gauge the state of all the organs, but we should always remember that as a whole, the tongue is an offshoot of the heart. So the heart has an important influence on the tongue. The heart, and therefore the mind, the spirit, has an important influence on the tongue. Okay, so what are the deviations from that normality in terms of body color? It's very simple. There is usually 5 colors, which can boil down to 3. It can either be too pale or too red, so today, when I talk about a red tongue throughout today, I mean too red, pathologically red, not normal red tongue. Okay? So it can be too pale, too red, or purple. There is basically 3 colors. You can make it 5 because the red color, there is a distinction between red and dark red. But that distinction is not a qualitative distinction. There is no qualitative difference between the two. It's only a matter of quantity, how much heat there is. Okay? And the purple tongue, you can distinguish bluish purple or reddish purple, which we'll talk about in detail. And there is also a blue tongue, but the blue tongue is very similar to the bluish purple tongue. So there is pale, red, and dark red, but these two are basically the same. There is purple, bluish or reddish, and there is blue, which is similar to bluish purple. So therefore it can be 1, 2, 3, 4, 5, 6 colors, which boil down to 3: pale, red, and purple. So that's quite simple. There's only three pathological colors: pale, too red, or purple. And let's start with the pale tongue. What is the significance of the pale tongue? That's very simple as well. It either indicates yang deficiency or blood deficiency. When we say pale, we mean too pale. Either yang shu or blood shu. In the case of yang deficiency, it might be slightly wet. In the case of blood deficiency, slightly dry. And also, in the case of yang deficiency, it might be swollen. In the case of yang deficiency, it might be thin. But there is an important exception to that. So how do you know if the tongue is pale, whether it's yang deficiency or blood deficiency, apart from the fact that it can be both? Many women have both. Loads of women have kidney yang deficiency and blood deficiency. Okay. You can tell from this the wetness of it, the swelling of it, and also very simple, this is more common in women, and this is more common, and this is common in both men and women. Both men and women, equally, men and women. Now there is an important thing to notice here. You see the swollen and thin tongue. In theory, I stress in theory, a pale tongue from blood deficiency should be slightly thin, but it never is, or it hardly ever is. That's why we call this advanced tongue diagnosis, because I try to tell you what happens in practice, not in the books. It hardly ever is, and why is that? Many people, especially women, have spleen Qi deficiency, which fails to make blood. So leads to blood shu and pale. Fails to make blood, leads to blood deficiency, and the tongue is pale. I hope I'm not getting Parkinson's disease, because I'm writing smaller and smaller. That's a symptom of Parkinson's disease. blood deficiency, and therefore the tongue becomes pale. Okay? But in a very, very high percentage of people, this also leads to dampness or phlegm at the same time, which makes the tongue swollen. In other words, what I'm saying is that especially for women, very, very many women have blood deficiency, but also dampness or phlegm. And the dampness or phlegm influence on the tongue predominates. They make the tongue swollen. The tongue can't be swollen and thin at the same time. Therefore, it is swollen. In the majority of cases, it is swollen. I have some statistics here from my clinic. There. I've made some statistics from my patient for about 2,200 patients, and 38% have a swollen tongue. 38. So it's very, very high. And only 1.9 have a thin tongue. 1.9. So you read in the books, in blood deficiency, the tongue is thin and the pulse is choppy, but in practice, it isn't. And it isn't because dampness and phlegm are such predominant pathogenic factors in the West. Very, very predominant, which make the tongue swollen. So there is an amazing discrepancy there. 38 swollen and only 1.9 thin. So the thin tongue is relatively rare. Yes?
Does it mean even if there is a blood deficiency, the tongue still can be swollen?
Yeah, that's what I'm saying. The woman has blood deficiency. The tongue should be thin, but it's not. It's swollen. Why? Because she also has dampness or phlegm, which is such a predominant pathogenic factor in the West. It is here too. I know. I've done tongue diagnosis in the United States, in Europe too. In Norway, I would say that the percentage of swollen tongue is even more than 38. I would say it's probably 68, for example, in Norway. Okay, so you will see a lot of swollen tongues and very few thin tongues. Depending on the... you mean in this country? In Norway? Probably, well, partly the climate, but partly also the fact that they have a lot of dairy foods in Norway, a lot of milk. In all these Scandinavian countries, they drink a lot of milk. Finland has the highest per capita consumption of milk in the world. Okay. But in England too is very common. In England probably it's more from the climate than the food, than the diet. Okay, so that's the pale tongue. It's very simple. Either Yangshu or Blood-Shu or both. Very many women have both, so don't think that you can't have both. It's very common to have both. And bear in mind that it is seldom thin.
When it gets damp phlegm, it gets
Swollen.
swollen. Does it also get moist or stay dry?
Usually it will get moist, yes. I'm going to talk a lot about that in a moment later on, but just as a preview, I'd like to clear up something which comes up in my lectures a lot. Many people say a swollen tongue indicates Yangshu or Qishu. I don't agree. A swollen tongue indicates A change in the tongue body shape indicates the presence of a pathogenic factor. Do you know what I mean? So, and that is dampness or phlegm. Of course, dampness or phlegm comes from qi deficiency, but the swollen tongue doesn't show qi deficiency. In the similar way that the slippery pulse doesn't show qi deficiency. The slippery pulse means phlegm, right? It doesn't mean qi deficiency. It's the same with the tongue. The swollen tongue indicates phlegm. It does not indicate qi deficiency. A change, when the body color becomes bigger than normal, there is a pathogenic factor. It's the same as the pulse. When the pulse is full, slippery, wiry, bigger than normal, overflowing, there is a pathogenic factor. Okay, so I'd like to clear up that straight away. A swollen tongue does not indicate qi deficiency or yang deficiency, but dampness or phlegm. And usually it will get sticky as well. It will usually be reflected on the coating as well, with a sticky coating, usually. But phlegm, as you know, is a very complex pathogenic factor which mixes with many different other pathogenic factors, and there is such a thing as dry phlegm, phlegm with dryness, in which case the tongue will be dry. And it's more common in old people. Okay, so that's the pale tongue. Any questions on the pale tongue? Of course, as I said, Chinese medicine does not measure things in the same way as Western medicine, but the tongue can. The tongue can. The tongue can be pale, slightly pale, very pale. Okay, so that gives you an idea of how much yang deficiency or blood deficiency there is. Of course, you can only judge that when you have some experience, when you've seen many pale tongues and you realize how many different degrees of it there are. Okay? Any questions on the pale tongue? Of course, if it's only very slightly pale, it can also indicate qi deficiency. It can also be qi deficiency. But generally speaking, qi does not show on the tongue very much. But blood does more. What does it mean? Qi is the tongue body color is influenced by the state of blood a lot. So if there is only qi deficiency, not yang deficiency, the tongue may not change very much. The same with qi stagnation. People may have very pronounced symptoms of qi stagnation and the tongue doesn't show it, because the tongue shows blood more than qi. Yes?
Wouldn't you rather than go for the pulse if you take qi stagnation and qi deficiency?
Yes, yeah, exactly. In qi stagnation, the pulse should definitely be wiry. And the tongue may show nothing. I could show you from my case histories hundreds and hundreds of women women with a pale tongue, or normal, but very pronounced symptoms of qi stagnation. And it does not show on the tongue. And it will definitely show on the pulse, though, being wiry. And that's another reason why the integration of the tongue and pulse, if you're good on tongue and pulse, it is, of course, it's great. It's because they are perfectly complementary, the tongue and pulse. They often show different things. They complement each other. The strength of one are the weaknesses of the other, and vice versa.
How about when there's a big discrepancy between the two?
I'm going to discuss that as well later on today, when there are big discrepancies between tongue and pulse. I'll talk about that later.
Do you mention about tongue dry and phlegm? Can you give me an example of that?
I think I'll give you examples when we talk about the swollen tongue. What I meant is that phlegm has many different types. There is damp phlegm, cold phlegm, phlegm fluids, wind phlegm, stone phlegm. There is also such a thing as dry phlegm, in which case the tongue would be swollen but dry, which is not at all uncommon. And dry phlegm is more common in old people. You see that quite a lot in old people. So you see that apparent contradiction, because the tongue may be very swollen, but instead of being sticky, it's dry. And that means usually dry phlegm. Okay, so that's the pale tongue. It's quite easy. Let's look at the red tongue, which is more complex. And just one more thing on the pale tongue. No, actually one more thing on the pale tongue. Sometimes it can be only partially pale. And when it's partially pale, it's usually always on the sides. Like that. Okay, so it could be, this is normal, and that's pale. And that's about the only place where the tongue can be partially pale. I've never seen a tongue that is only pale there, or only pale there. And that means two things. It can be two possible things. If it's pale in that area like that, or like that. Okay, pale. This indicates spleen Qi deficiency or spleen Yang deficiency. And this, more likely, liver blood deficiency. Yes?
Have you seen with the liver blood deficiency where it includes the heart area, where it goes right around?
Not. I know people always ask me that question. No, not really. The question is, have you seen a paleness in the liver area that goes right to the heart area? No, I haven't. I've never ever seen a tongue that has a pale tip. You have? I haven't. The reason is probably that by the time you have heart blood deficiency, the whole tongue is pale, because heart blood is so important.
I saw it in somebody who was just in an accident.
Yeah, well, that's different. That could be, yeah, that's different. Okay, so a partially pale tongue is usually on the sides, and you should distinguish those two different situations. Here is a rather wide area, could be even wider than that, and more in the central section. Here is all along the side, and the first one corresponds to spleen Qi or spleen Yang Shu, the second liver blood Shu. And they are both very common situations, those. Both very common. In the case, just a moment, in the case of liver blood Shu, in a few cases, that could become orangey color, and that indicates severe liver blood deficiency. Yes? These two, you mean? Well, this I would interpret as lung Qi deficiency. This one are definitely never seen. Never. A tongue that is pale only on the root. Of course, the interpretation would be kidney yang deficiency, but the reason you don't see it is that by the time you have kidney yang deficiency, the whole tongue is pale, not only the root. There was another question there.
Well, the reverse of the very first one that you've got, where instead of being pale on the sides, you've got the liver Qi stagnation red on the side, but pale on the body in the middle.
Mm-hmm.
Is that another comment?
So, pale here, and here what?
Red.
Yes, yeah, that does happen. Yeah, yeah, that does happen quite a lot. Not unusual. The reverse, pale in general, but slightly, yes, that does happen quite a lot. But red here. I haven't mentioned this because we're talking about the partially pale tongue rather than partially red tongue. But this most probably indicates liver blood deficiency and quite severe liver Qi stagnation. The two things, these two conditions, liver blood Qi and liver Qi stagnation, very often occur together in women. But if you see that, what does that tell you compared to this? The tongue that is normal here and red there. What's the difference between those two? They both may indicate liver Qi stagnation. Just a moment. What's the difference? The difference is in the first case, you can deduce that the liver Qi stagnation is secondary to liver blood deficiency. So liver blood deficiency has been there for longer. In the second case, it isn't. The liver Qi stagnation is arising by itself from emotional stress. Yes? Yeah. That is the main difference. And liver Qi stagnation deriving from or associated with liver blood deficiency is very common in women. Very common. Okay, we'll talk more about this tomorrow. So, for the red tongue, sorry, one last thing on the pale tongue. The pale tongue usually has coating. Has coating. Usually has a coating. There is a pale tongue without coating, but that's quite rare. Pale without coating. It indicates very severe blood sugar. Very severe liver blood deficiency.
Pale with coating or pale without coating?
Pale without coating is rare. Is rare, I mean, in 26 years of practice, I might have seen 4 or 5 of them. And indicates very severe blood deficiency. Okay, so let's talk about the red tongue. Yes?
Would that be very dry?
Yes, it should be very dry, yes. Now, the meaning of the red tongue is closely related to the coating. Red indicates heat. Okay, that's certain. It cannot be anything else. But it can be full heat or empty heat. Full or empty. And you see that on the tongue very clearly. If it's full heat, the tongue is with coating. Empty heat is without coating. Again, this is very important distinction. It's something, again, which is not always done. As I said, people ring me and they say, I got the patient with the red tongue. And I say, is there a coating or not? And they say, oh, I don't remember. I haven't looked. Well, that's the first thing you do. If you see a red tongue, that's the first thing you do. Does it have a coating or not? With the coating, no matter what the color of the coating is, it could be white, which is a discrepancy. Yellow, gray, black, brown, indicates full heat. If it has no coating or rootless coating, which we're going to describe later, or rootless coating, it indicates empty heat. Okay, so in the example I gave you this morning of menopausal women with an overlap of kidney yin and kidney yang deficiency, I said if the tongue is pale, it's definitely a predominance of kidney yang deficiency. If the tongue is red, there's a predominance of kidney yin deficiency. But I should have said if the tongue is red with a rootless coating or without coating in some places. The tongue doesn't have to be without coating all over. It could also be partially without coating. Also partially without coating. Yeah?
So when there's partly no coating, that would be a rootless coating as well?
No. I'm going to talk about this in detail when we discuss coating. But basically, this is a tongue with no coating. There's no coating on it at all. This is a tongue that is partially without coating, say, like that. The coating is missing there. Partially without coating. Still empty heat, yeah. Or the coating could be rootless, which I usually just draw like that. This rootless coating, which would be the very beginning of empty heat, of yin deficiency. The very beginning of it. But we'll talk about this in detail in the afternoon, in great detail about the coating. Because again, it's a very important thing to understand and something which, in my opinion, is often misunderstood. The significance of the coating in relation to yin deficiency. Okay? So the redness of the tongue indicates heat. In the case of empty heat, the redness of the tongue reflects the empty heat. It does not reflect the yin deficiency. Do you understand what I mean? It does not reflect the yin deficiency, which is at the root of empty heat. Is that clear? The same way as with the pale swollen tongue, the swelling of the tongue doesn't indicate qi deficiency, it indicates dampness or phlegm. Here, red tongue without coating indicates empty heat. Doesn't indicate yin deficiency. In other words, the yin deficiency is indicated by the absence of coating. The heat is indicated by the redness. Okay? The yin deficiency is indicated by the absence of coating. The heat is indicated by its redness. Okay? The more red it is, the more heat there is, full or empty. Now, is that clear? Do you have any questions on this? It's very important to understand. So when you see a red tongue, the first thing I ask myself, is there a coating or not? Is there a coating with root or not? Is the coating totally missing, partially missing, or perhaps rootless? Any of those indicates empty heat. Let's see. Is that clear? Red tongue indicates heat, which may be full or empty. However, unlike the pale tongue, the red tongue, there are many different types of distribution of redness. You got this in your handout, I think. Very common one is the tip, extremely common. Indicates heart fire or heart empty heat, depending on whether there is a coating or not. Yes?
And does that mean that the rest of the tongue is a normal color? Or is this just globally red tongue with a redder tip?
The question is, does that mean the rest of the tongue is normal, or is it a globally red tongue with a red tip? Both. This is either a normal tongue and only the tip is red, or it is a red tongue and the tip is redder. The significance is the same.
My question is, you can consider a tongue red if just the tip is red?
Yes. Well, I would call that partially red. And the redness on the tip indicates heat. And where is the heat? It's in the heart. And is it full heat or empty heat? Depends on the coating. Okay? Yes, I would call that a partially red tongue. But this could also be a completely red tongue, and that is redder, which is, of course, worse. Right? That's common. The same situation. Either the whole tongue is red and the sides are redder, which is common, or the rest of the tongue is normal and the sides are red. Red indicates heat, the sides indicate liver, so that's heat in the liver, full heat or empty heat, depending on whether there is a coating or not. this is a very common situation, very frequently seen. Either redder sides or only the sides are red. The tongue could be red here in the center, and that's the stomach area. So again, that's stomach heat or stomach fire or stomach empty heat, depending on whether there is a coating or not. I should actually add something to that. You can add another type of stomach heat to that, where it's red on the sides. Like that. The same area where it was pale, you remember? The same area. In other words, any changes in the sides, but rather wide, and the middle section, you see that, reflect the stomach. And this would be stomach heat. In other words, the condition of the stomach, in this case stomach heat, can be reflected in the center or also around the center. And what is the difference? The difference, I would say, is that this is probably more long-standing. When it's right in the center, is more long-standing than when it's red on the sides. Was that your question?
You know the difference between the stomach area versus the wind heat indication?
We're coming to that. Yeah, that's slightly lower down. Lower down. We'll come to that. Just to answer your question straight away, the wind heat area would be lower down, like that. Okay? There was another question there?
I have a question that always has that red peel area in the center. He's stung it from the hard candies that he sucks. Can that do that?
No. The question is, she has a patient who has a red peeled area in the center, and the patient attributes that to sucking hard candies. And no, I don't think it can be due to that. That's definitely, is it with coating or without coating? Without coating. It was definitely stomach empty heat from stomach yin deficiency. Definitely. This is a good example. You see, I stress a lot the fact that the heat is shown by the redness of the tongue. The yin deficiency is shown by the lack of coating. And the treatment is very different. Your patient, with a tongue like that, with a redness in the center and no coating, indicates stomach empty heat from yin deficiency. But the emphasis of the treatment should be on clearing empty heat. So I would choose a clearing empty heat prescription rather than a nourishing yin prescription. Something like Yunu Jian, the Jade Woman's decoction, or Qing Wei San male. Yeah. Whereas if, supposing that person had a coating missing in the center but not red, then that's purely stomach yin deficiency, which requires nourishing with sha shen mei dung tang, for example. So it's a very important difference, because if it's red, there is heat, and you clear heat. If it's only the coating that is missing and it's not red, it's yin deficiency, and you nourish yin. Okay, so that's stomach heat, and that's also stomach heat. A redness here notice the difference between the lung heat and heart heat. The lung area includes the heart area. Okay? It incorporates it. So how can you tell whether it's heart heat or lung heat? Simply from the size of it. With heart heat, it's only the tip, the very tip, that is red. With lung heat, is a much wider area that is red. Again, lung full heat or empty heat, depending on whether there is the coating or not. And these are the main areas where you see a partial red color. Again, I have never seen, well, except once. I think I got about 200 slides. I have one slide of a woman with the redness there. Why? Because that would be the kidney area. So a redness there indicates kidney yin deficiency if it's without coating. And why do you not see it? Because by the time you have kidney yin deficiency with empty heat, your whole tongue is red, not just the root. And as I said, of all my slides, I have one with that. But these, well, all four of those, that stomach and lungs, are very common locations of partially red tongue. Or a tongue that is globally red and redder in those areas, which is, of course, worse. Okay? If you have a normal tongue here and only those are red, I would say that's a slight liver fire, not a very serious condition of liver fire. But if the whole tongue is red and those are redder, I would say that's quite severe liver fire condition. Okay, let's look at the wind heat one, the wind ones. On the tongue. The question was, how do you see the difference between liver chi stagnation and liver fire on the tongue? Because I think a few moments ago I indicated that as being due to liver chi stagnation. Yeah. Generally speaking, how can I say it? If you have a tongue that is red on the sides, and this is normal, you would say that's quite severe chi stagnation, which gives heat, which generates heat. So we really go back to heat. Okay? So basically, we go back to what we said in the beginning, that chi stagnation may not show on the tongue. So when do you decide whether it's liver chi stagnation or chi stagnation giving rise into heat? It's difficult to tell, but generally speaking, if it's red, there is some heat. And if the rest of the tongue were normal, you would say, well, that heat probably derives from severe liver chi stagnation. Yes?
Combination where it's obvious liver chi stagnation, you look at the tongue and the sides are a dark red.
Yeah.
What does that indicate?
A lot of heat. But the rest of the tongue is not red?
Slightly.
Well, I would say there is a lot of, there is liver heat, definite, quite severe liver heat, deriving from long-term liver chi stagnation.
And the same red edges with a pale tongue?
If the tongue is pale and the sides are red, I would say it's a very slight liver chi stagnation.
Even dark red?
Yeah, even dark red, yes, I would say so. And most of all, I would say, with the pale tongue, that liver qi stagnation is associated or deriving from liver blood deficiency. Unlike the other one if it's all red. Yeah. And the tongue is actually quite useful to make that distinction in the treatment. Because supposing this is normal and red sides like that, that's liver heat deriving from liver qi stagnation, which is treated not so much by clearing heat, but by eliminating stagnation. Do you know what I mean? It's a very common thing, liver heat derived from liver qi stagnation. You treat it by removing the qi stagnation primarily, okay? Not so much by clearing heat. Whereas if the whole tongue was red and the sides are redder, then you need to clear heat, clear liver heat. So as we see gradually in the course of this lecture, the tongue is very useful to apply the appropriate, precise method of treatment. Okay, and let's look at the wind ones.